Welcome back to the Funny Thing Is podcast. I'm your host, Nicole Birch, where every week I bring you a guest who shares a life-changing event, the medicine they took to get better, and the funniest lesson they learned along the way. Today, I have a very special guest for you, a good friend of mine, and not only is he the CEO and founder of Augi Health, he's here to share the story today. Welcome to the stage, Karen Moulene.
Thank you for having me, Nicole.
Thank you for doing it. So, the beginning of the show,
you really got that intro on.
Right?
Yeah.
I was trying to think how we met.
Yep.
I always tell people how we met. So we met during the pandemic, I assume.
Had to have been. Early pandemic.
Because that was how we, yeah. So through Selena Warren and Marissa Reed.
Yep.
And so
S&M, as they go by.
S&M. And you guys, they've been on the podcast before. Look up that episode. But they were like, hey, it was like COVID. Nobody was working. I was a struggling single mom. I went from 6 figures to food stamps so fast.
Yeah.
And they go, well, one of our friends, Cameron, because you were on one of their shows, Foursome, they go, he's starting a company, or I don't know what it was, but they're like, he's looking for somebody to do COVID compliance.
At that stage, I didn't know what it was either.
I don't think either of us did. And so you had me come on board, and I started off like small, just like checking people in, then testing, then like kind of, and I was so grateful for that. And I think I've told you how grateful, but I don't think you understand. Like financially, I would not have been able to last another 6 months in LA with that gig. So super grateful to you.
Well, that makes me really happy to hear. I didn't know that.
You always have such a special place in my heart because of that.
Wow.
I know. Did I never tell you that?
No, I had no idea.
I think it's because I was your employee and I didn't want to be like, but it was such a gift, and I was paid very well. And I got to meet my now friend, Jen Sturger, who, ran the Schmodown and doing COVID compliance for that. I was on the set with Meghan and Harry when they did the Times cover.
Yes.
And it was so many. And
we did a lot of shoots.
We did so many.
Well, you know what's funny is like, it's sweet to hear you say that. But for me, it was almost identical. Like, I feel like most people had this like 6 figures to nothing food stamp story that you talked about.
Yeah.
For me, it was basically food stamps to 6 figures through COVID production
that.
services.
Yeah.
I had $3,000 in my bank account and was living at my mom's house with a newborn baby.
Yeah.
When that happened.
And we were both single parents.
And
our kids got to meet one time, which was really sweet.
Very sweet.
It was so sweet.
I just learned that what happened was they made up this job. Hollywood. They made up a fake job.
1,000%.
And they were like, COVID compliance officer, 1-20 ratio on every set. You can't have a production without it.
Yeah.
And they need to do all the compliance across like the face masks and the distancing and all this stuff. I was like, that's a made up job. And it turned out it was a made up job.
It was a made up job.
And you could get a certificate and do it. And I think before you had even come on, because you were the adult, right? Like you were actually, you knew what you were doing and you were a professional.
Yeah.
I went and got like 20 kids in the Valley that were out of work, and I put them through this $50 training.
Yeah.
And started staffing them everywhere.
Yeah.
And then when you showed up, things started to get professional and things actually started to be managed.
I was like, I'm really organized and I like labels. And you were like, oh, okay, do that. Yeah.
But it was kind of my first entry into healthcare in a funny way. And I had a 3-year gap doing something else. But what I found out was that we would go on these productions and I would pretend to be the supervisor when I'd showed up. I was like 26 years old and had no business being there.
It was great.
And I'd be like, what's your biggest pain point? And the producers would always say these antigen tests. We're being charged $200 per test per doctor.
Right.
And I guess no one had thought to call the labs that made the tests, because when I called them, I finally got somebody on the phone and I was like, hey, I've run this compliance company. We've got some RNs on productions. We're trying to get these tests. They're like, oh, great. Well, we sell them to anybody. And I was like, oh, well, great. How much can you give me? Like, can you give me a deal? I know they're expensive. They're like, well, we're federally mandated to start at $5. But if you buy more, they go to... And I was like, do you have any idea what they're selling them for out here? And they go, oh, we can't control the middle market, but we have a federal mandate. It's $5. So I bought as many as I could. And the reason we got those big clients like Warner and Sony is I went to them and I said, I'll get the RNs to administer them and I'll only sell them for $100. And we undercut these doctors that were,
because I was like, I remember telling my friends, I was like, thank you so much for Selena. And I was like, thank you so much for introducing me to him, because he's so smart and so business savvy, entrepreneurial, all of that stuff, which is also what we're going to talk about today.
Yeah.
But with that stuff, I was like, I want to hitch myself to that wagon. And then we started talking about NFTs and I was like, that's above my pay grade.
Well, I went down that rabbit hole for about 3.5 years and had some really great stuff happen, and but it's a very different world. Very
Yeah.
stressful
I was
stuff.
like, I'd rather just swab noses. Can we do that? But
Yeah.
no. So I was like very inspired and very lucky that you came into my life.
Yeah.
Also you're a brilliant actor. Just want to say that.
Well,
But
thanks.
but
You too.
thanks. Okay. So what is a life-changing event you want to share, which might lead into the why of what we're going to talk about today?
Just pick one out of a hat. A life-changing event.
Anyone. Yeah.
I think having my son is the most life-changing event for me.
Right.
Yeah.
He's so cute. And his name is Augie.
His name is also Augie. Yeah.
He's the best.
He's the cutest little guy on the planet. A little gumdrop.
And so blonde still?
Oh yeah,
mine's still so blonde too.
He does not have my hair genes for.
So Everly, this is dyed. So like Everly's dad and I are like your hair color.
Right.
She's still so blonde and she's 6. She's like Augie.
But I feel
blonde.
like it kind of changes at 7 for some kids.
Yeah.
I think Augie is she as blonde as Augie?
No, he's like platinum much, but she's got like these highlights that you pay millions of dollars in Beverly Hills for.
Yeah.
She's got that. Yeah. How do we go from Augie to Augi Health, which is what we're going to talk about today?
Yeah. Well, the short version of it is just that I was doing the company between COVID Production Services and Augi Health. That did super well, and then towards the end, there was just after FTX, it was a crypto company for people, and I had been in crypto for a long time, and I found digital ownership really interesting and was trying to build this bridge for creators in Hollywood to own their IP by launching NFTs.
Yeah.
FTX happened, which was a big crash of a major exchange, and no one in Hollywood wanted to touch crypto anymore. So the whole business model just fell apart overnight.
Right.
And I was like trying to sell some tech from that, and my son, Augie, was 2. And he got this diagnosis, right? And at the time he was nonverbal. And I just began, like I had the time and the resources, and I was like, I'm going to go all in on obviously taking care of my son and figuring out what is going on.
Right.
And it was really the journey of navigating his care team and all the fragmentation of data and providers there, where I went, I need to build myself something that can manage this better. And when it was so effective at doing what it was supposed to do, and I had spoken to my now co-founder, Alex, kind of about this being a universal pain point, we just landed on like, we can generalize this and make this really effective and try to rebuild like a whole different paradigm on like how health data should be owned, moved, and acted on.
Yeah, I don't think there's a single person in this country that thinks our health system is,
No, yeah, that's a universal feeling. Yeah, we're not crushing it in that category.
We are not. No. And I do love when I was doing the research that you said, you could try to fix what is clearly broken, or you could just rebuild.
Yeah.
Right. And that's what this seems like it is.
Yeah, absolutely.
So ironically, when I was in college, I did my dissertation on universal health care, which was a very unpopular dissertation at the time because it was.
I didn't do anything in college because I dropped out.
That's okay. You're doing just fine. And in that, now the dates are a little different. It was because like back then, 42 million people were uninsured. Now it's 27 million, so it's better. But 14 billion.
Obamacare.
Right? Yeah. But $14 billion is spent every year to advertise for pharmaceuticals.
That seems low, to be honest.
I think it is low. This was a rough estimate, and that's direct to consumer. So there's other things, but $14 billion for advertising would actually insure everybody who's uninsured. I think most people, when you go to other countries, they don't realize.
But how would the pharmaceutical companies make money off of that?
Exactly. Right. So if you go to other countries, I remember the first time my cousins came to visit from Norway, they were like, what's eczema? Like what? First of all, they don't really have eczema. And I was like, what the fuck? And they go, why is there so many commercials about eczema? And they're like, isn't that like shady that they're trying to sell you guys drugs? And I'm like,
what is this diabetes you speak of?
What do you talk about?
This is a rare condition.
What is happening? Yeah. And then you don't, because we're so inundated with it and it's been around for so long that they've been able to advertise like that. But if you took that money, you could actually, and everything is so backwards and so corporate greed.
Well, I think by the way, that's a great point. And there were some stats that I was looking at the other day that blow my mind, right? Where in the United States, how much of our GDP do you think is made up by healthcare?
Ooh, I have no idea.
20%.
What?
20% of the money that is flowing through the United States on any given year, healthcare. Counter example, the average GDP of a country is usually within 6 to 12%. And those are because they're significantly more effective and generally single payer systems.
Yeah.
But because we have a multi-payer system and we've done this great American experiment in every way, right? Allowing capitalism to drive this, and be the first one to say I'm a capitalist, right? But like are there inherent issues with those systems?
Of course, yeah.
When you're looking at something like healthcare.
Right.
The GDP is nearly 4 times that of an efficient system like Taiwan, for example. And the reason for that is like every executive team at every big health insurance company, every big pharmaceutical company are skimming like hundreds of billions of dollars every year off the top as performance bonuses.
Right.
Right. So more so than like, oh yeah, they're spending money to advertise their own drugs. That is what it is. I think the problem there is like, how are you advertising it? Why is everyone so happy in this commercial when the actual product, the side effects are being read off and it's like could lead to death. And horrible, and then everyone's like, yeah,
and they're doing like volleyball on the beach.
That's its own issue that's getting addressed. But I think that the real problem is that there is a tremendous amount of inefficiency, waste, and frankly just excess spend going on because we've allowed this system to get so fragmented and so focused on the interests of the corporate needs.
Right. And I also think like the United Healthcare shooting, well, obviously not for that at all. Oh, no. But he was making what a year? And you're like $80 million or something ridiculous. Sure. But and then there's people that are being denied for like basic care. There's like a connect there.
Well, yeah. I mean, like first and foremost, I would never condone any kind of violence.
Right. Same.
Right. Like just, and I'm not saying that because we're on a podcast. Like when I saw that happen, my first thought was like, that is horrible. Right. And then I always, as a dad, I go to, that's a father. Right. And these are kids that are going to grow up without. Yeah. So it's awful. But what it starkly points out is people in the United States are furious and they don't have good options.
Right.
And they don't know what to do next. And they have loved ones who've been through United's underwriting process where they're really just a person in a queue or a number on a spreadsheet, and they don't feel like it's personalized and they don't feel like they're heard, and they feel like they're paying a ton of money, a ridiculous amount of money, either through their employer and what's being taken out of their paycheck or single payer of themselves, right? And they're not getting care. And they're not getting taken care of.
Right.
And it's impossible. And it's a hard landscape. And so I understand the anger.
Right.
Where that comes from.
And to even say the way that we've done it with capitalism and stuff, that it's working. And like we are, an industrialized country and we're one of the most successful countries, blah, 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 based on different.
It works great if you're rich.
It works great if you're rich.
It works great if you're rich.
But then you look at like, we just had this on the last podcast, maternal rate. Like, and Norway is 0 deaths out of 100,000.
Mm-hmm.
We're 18.6. Now it's gone down. I think like when Everly was born, it was like 26 out of 100,000. And now it's down to 18. But I'm like, we're still the highest mortality rate for mothers in the industrialized countries.
Yeah, this is a fun shill for a partner that I've spoken to. But there's this company called MyRoad.
Okay.
And they do a facial scan. So it's a diagnostic tool. I believe that it's a non-medical device tool, but it's a diagnostic tool that can give you a read. 30 seconds scan on your face. It can read your blood pressure, your stress levels, a bunch of different variables with like clinical accuracy.
Okay.
And where it is most efficacious is for pregnant women.
Oh my gosh.
To cut down on the risk of onset pregnancy, diabetes, and then the highest contributing factors to maternal mortality.
Yeah.
Yeah.
Oh my God.
Really cool. There's really cool technology that's coming around. Because that is like, you need great remote monitoring tools to help ensure that those levels don't get into a critical range. And, even as a pregnant woman, how many times when you're pregnant do you go to the doctors? It's like,
oh my God, I was months. A geriatric pregnancy, so I went like 9 or 10 times probably.
Oh, okay.
Yeah.
Well, there you go. Good for you.
Yeah. Well, I found out that
the secret.
I didn't even, you just have to be old.
Yeah.
And I didn't even realize this, but I was talking to my friend who had hers when she was 32. And so I was 36, which is like 1 year over. So I was geriatric. She goes, oh, well, we only had 2 ultrasounds the whole time. And I was like, girl, every time I went in, I got an ultrasound.
You got an ultrasound.
Because of that extra level.
By the way, the disparity in care is another great example.
You should be having that anyway.
Yeah, you should be getting that all the time too. Yeah. And I think that, it's also just like women's care. in the United States is something I'm learning more and more about. But sometimes the value of something like a MyRoad is you might be going in and checking those levels on a regular basis. You go into the doctor and they might not do the ultrasound and they might not even do the full physical
Yeah.
test. And a woman could say like, hey, I actually think that this is going wrong. And a doctor would be like, maybe you're just going through the hormones of being pregnant.
Overreacting.
And that is a reality.
Yeah.
Right? That happens all the time.
Right.
And
that happened with me. So after I gave birth to Everly, for weeks, now I learned hemorrhaging, but they told me it's your first baby. That's normal. And I'm like, okay, well, it's week 4 and I'm still in a diaper full time. I don't think that's normal. So I'm asking other mothers because nobody's talking about it. And then the doctors, I'd call the front desk and they're like, give it another week. Give it another week. So I start like passing out.
Oh, wow.
And it's me, single mom alone at home. So I'm like, so I finally drag my body with my newborn into the doctor's office and I cause a scene.
Right.
They finally show me back. The sonographer puts the gel on my belly and she goes, I'll be right back. And you knew instantly. And she goes, the doctor comes in and he looked at it and he goes, okay, you have a retained placenta. And I'm like, I still have placenta in me. And he's like, we're doing emergency surgery. They normally catch retained placentas within 24 hours. It's in a major infection.
How long?
5.5 weeks.
5.5 weeks of you saying, hey, something's wrong, something's wrong.
I could never breastfeed to completion because my body was confused whether I was still pregnant or not. It gave me Hashimoto's, which is an autoimmune disease. I
have Hashimoto's.
Do you?
Yeah.
Look at us. Look at our thyroids. Look at that.
My overproductive thyroid.
Mine's under.
Oh, maybe that's what mine is.
Yeah.
I think you have a high TP count, right?
Mine's
still
the
mild.
Antibodies.
Yes.
Yeah. Yeah, look at us. We have so much in common. Autoimmune diseases. And from that, I was like, it only took me going in and screaming. And I was like, I'm either leaving here in a body bag or you're checking me out. And thank God they did. And I didn't get like arrested for causing a scene. I also scared a lot of pregnant women in the lobby, which I apologize for. But
good, because then if anything like that happens to them, they're going to go, I remember that crazy lady.
And she got sane.
Exactly.
Yeah. And I was absolutely nuts. And because I was like, nobody's listening to me.
Yeah.
And I'm like, and he felt when the doctor ran in, it wasn't even my doctor. When he ran in, he was like, I am so sorry. And I was like, fix it. You know, it was crazy. So that happens a lot. And like I've told that story in my stand-up and I've told that story before. And the amount of women that comment, it's like, oh God.
Yeah.
It's so much more common.
Absolutely.
Yeah. That's why I wanted to have you on because I was like, oh, please fix this.
Well, so I mean, we can get into Augi and I can tell you.
Yeah, tell me how it works.
Yeah.
I think like the streamlined version.
The streamlined version is like first and foremost. Healthcare is the most complicated industry in the world, right? So this notion of like, well, we're going to fix it is silly because there are so many factors from, you can go as fundamental as like, well, everything is driven by capitalism. And so health systems need to make money.
Right.
And really what the biggest problem as I saw it in healthcare was this. Software in healthcare is namely defined by one big company. They're called Epic. They have an amazing story. It's a female entrepreneur from the 70s. This woman, Judy Faulkner, she built the whole thing. She never took any VC money. She refuses to sell the company. She refuses to buy other companies. In a lot of ways, they're an incredibly inspiring company.
Okay.
They built their company, their software, for health systems. Those are their customers.
Okay.
Health systems are distinct from your doctor because your doctor might go and work for a UCLA, but they don't make a lot of the administrative decisions that are going on. They want to be a doctor. Working at a big hospital gives them access to tons of incredible tools and tons of incredible resources and a broad patient network where they can make money. But the health system is the employer.
Right.
And that health system is a business. They got to make money. So what do they need their software to do? Be really efficient at billing codes for the insurance that is their primary payer or Medicare. So inherently, that software over the last 5 decades was built and designed to benefit billing.
Right.
Not for the doctors, certainly not for the patients. And that's the fundamental problem. Because in a bunch of ways, a health system doesn't want to share your data. Your data is a gold mine, right? They're able to do tons with their data. Their clinical research they can use it for. They can de-identify that data and sell it to pharmaceutical companies. There's so much that they don't actually ever want you to leave their health system because they'd be losing a customer because you're their customer.
Exactly.
So the result of which is you as an individual may have been, and the average American, right? 40% of Americans have been to 3 different health systems in the last 16 months. So your data is fragmented across a long landscape. And there's a lot of things that I don't want to, this is not an episode about shitting on Epic. They're doing a lot of things about unifying his universal patient ID across all their systems, which is great. But the problem is that you live in a landscape in the United States, again, capital inherently,
Right.
that has a multitude of different health systems. And while Epic is the biggest, controlling roughly 40% of all big health hospitals, you have Cerner, Athena, ClickPoint Care, 2,000 others.
Mm-hmm.
And they all store their data,
Mm-hmm.
right?
Mm-hmm.
And so when you're navigating care, whether it's your concierge doctor, your specialist, your PCP, the hospital that you go to when you're going to give birth,
Right.
all that data goes into different silos. And you don't have it. And so your health story doesn't actually continue this longitudinal and cohesive story about what's going on. So what we sat down and did, I had to do this for my son manually. I had to fight every single doctor on a 9-person care team because I was like, why is the speech pathologist not listening to the clinical early childhood development neuroscientist? And why is this ABA therapist not understanding that, like, my son learns language in a certain way, but what they're doing is counterproductive to it?
Yes.
So I unified everything, and I built one model that just said, take these vectors and unify. And then I'm his primary proxy. So despite having a care team, I'm with my son 80% of the time.
Right.
Make a dumb person understand what's going on and give me actionable steps on how I can do something about that.
Mm-hmm.
I shared that with his care team. I implemented it at home. Within 6 months, my son was verbal. Now he's in kindergarten and he's doing incredible.
Stop.
So it was enough of an early use case where I was like, I sat down with Alex Rowland, who's a really talented engineer I've known my whole life, and or since we were in high school, and we were like, we can build this. And so for a year, we just learned, because healthcare, again, the most complicated industry in the world, right? And what I learned is there was this law that was passed in 2016 called the Cures Act. Obama, as he was leaving office on the tailwinds of Obamacare, passed the Cures Act. And something really, really important that a lot of people didn't know about the Cures Act was that before that, in federal court, health systems were arguing that they own your health data. We own it because we generate the imaging, we generate the reports, we generate everything, and then we have the onus of responsibility should there ever be a leak. Therefore, it's actually ours. And they ended up winning that argument, saying, well, if the onus of responsibility is them and we generate the content, like, yeah, you own it. But the Cures Act mandated that an individual should have easy access to all of their health records, regardless of where they're being stored.
Okay.
Right?
Right.
So bear with me because it's really important. So what came on the tailwinds of that was what's called like an API standard. APIs is how different software systems can communicate with each other and share data. So an API standard was established. Every single health repository needed to implement it such that a proxy company on behalf of the user could go in with your permission and aggregate your records for you.
Mm-hmm.
And in doing such, we realized, well, since they all have this standard, and it's getting better now too, there's TEFCA, which is the next stage, which means if we can identify you with something like CLEAR, which has what's called IAL2 identity verification, which means I can 100% assure you that this is Nicole Birch.
Right.
We can then go find your records for you.
Great.
That's not working yet.
Okay.
It will work soon.
Okay.
Sorry. Today, what works is, Nicole, if you know where your records are, I can plug you in directly into UCLA Health Group. We can pull everything with full history. I can take you to SUNY in northern New York. And so what Augi did was we've plugged into 70,000 hospitals and health groups across the country. We've plugged into the NPI database so that we have access to every single doctor that's gotten an NPI number in the United States. And we've plugged into 300 plus wearables and hardware devices for equipment.
Yeah.
You can unify all of those data streams in one place.
Amazing.
And get a holistic and longitudinal health story. And then we take it a step further. So the fourth leading reason people use ChatGPT up till today is, hey, I just got this lab, I don't understand it. So it's getting insights on a single medical record. It's the fourth leading reason is why they're going to go into healthcare too. And the problem with that is that it's in a vacuum, right? You have a very limited context window of this one lab, this snapshot of this moment. Tell me about it. And so what LLMs do really, really well is they take that context window, they summarize, and then they go across the internet and pull as much data as they can that works with the keywords that they're searching, and they give you some insights.
Mm-hmm.
Well, what's more powerful than that is give me a full synthesized, all my data streams in one context window that is longitudinal on my health history, and now give me some insights.
Totally
And
different.
we don't use OpenAI because of a lot of different reasons, but we do use Anthropic that has by far the best citational guardrails, and we have a BAA with them so that it's all HIPAA compliant.
Okay.
But that's the real magic of the
Yeah.
foundation of Augi is like you can come in, unify everything that's relevant to your health, then have a chat that gets full context on your entire health history, and then communicate with it so that you're gaining information and insights, and then we give you portability.
Right.
So the portability part, that's the trickiest thing.
Okay.
So today, you can add any of your doctors on your care team, input their email, and then send a summary of your whole health history. So think of it as like a pre-appointment prep or a new patient onboarding form. I want to kill the new patient onboarding form. They don't need an account with Augi today because you're just sending the email and you have to verify this is the right email, make sure you're right, and then you can send that record over to them. Eventually, we will build something for providers where they have a complete view into the patients that they're looking at, as well as unified care chats, so that when I go into Nicole's account as a doctor, I can talk to each specialist in real time and I can get insights. And I'm also getting predictive analysis and like all of the aggregated data that I would have otherwise been trying to go out and find using these B2B tools like Zeus or whatever. It's all there because you become the nexus of care. And that's really like, it's almost more of a protocol than it is a business today, which is why I'm not charging for it. But the idea is, and the protocol is, I think objectively, it makes more sense that my health records live with me and that I should designate where they go.
Right.
And so long as, fine, maybe the health group that made the scan gets a copy of the scan, that's fine. But I should have a copy too.
Right.
And I should be able to move that wherever I want, whenever I want, both for triage and ambulatory and urgent care needs, but also just for the administrative ability to say, yeah, I'm going to this new doctor. I don't want to fill out the new patient onboarding form. I don't want him not to know my whole health story. I also want to be prepared for the appointment. So I want to be able to talk to Augi and say, what should I ask this doctor? Okay, great. Now I'm going into this appointment and I'm armed.
Right.
And I know what I'm doing and I can be the executive of my health story.
Well,
so that's more or less it.
Yeah, the best healthcare I ever got was from a functional medicine doctor and she was also an acupuncturist, which sounds insane because you think that the Western medicine that should be where it comes from. And she was like, well, she spent 2 hours talking to me because she goes, I need to know everything. I need to know how the delivery went. I need to know. And she was the first one that was like, okay, I think you have Hashimoto's. And then she was like, I think you have...
Did you take a blood panel and test for Hashimoto's?
Yeah, but only because I saw her. My doctor.
And then it was confirmed that your antibody count was high.
Yeah. Oh. Yeah. And now it's like, I guess they call it in remission. Like my TSH is like under 2 and all that stuff. My antibodies went from 200,000 to 16.
To 16?
To 16.
Oh, wow.
But if you have anything, it's still considered Hashimoto's.
Yeah, yeah.
Well, 16 is like highly.
Mine levels at around 5, 6, I think, and like the threshold is 4. But my doctor's like, you have a family history of this, like it'll go.
Yeah.
No, you're fine. It's like just manage it. I take selenium. Not giving any kind of like medical advice, but I take a selenium supplement every day.
I'm not on meds
that's
anymore.
all I'm supposed to do now.
I do gluten-free and dairy-free.
Yeah.
And that changed a lot.
Gluten-free and dairy-free.
Yeah, gluten-free mostly.
Wow.
That's the one that like really, and I used to have a bit where I made fun of people that were gluten-free.
Because
I'm like, unless you're a celiac, it doesn't really, and then I did it and I was like,
unless you're a celiac or a Hashimoto.
And I was like, dang it, man. That's karma just coming back because I thought I knew everything. So where is it at now? Like, can people sign up? Like, what's it look like now?
Yeah, absolutely. You can sign up for our wait list.
Okay.
We're launching the beta at the end of the month. So we're in December right now. So it's going to launch in December. Completely free to use today. And I foresee it having a free tier forever. I think part of our mission in this like protocol stage is I want to meaningfully democratize healthcare. And so there will absolutely be added features and new tools that like we'll charge consumers for and we'll give you like access to. But I think on a fundamental level, the ability to aggregate all of your records and all of your data streams and make that portable such that you can share it with at least a limited amount of key providers or key if you're a dependent, like I want to be able to share it with my daughter who's taking care of my health, or I want to be able to share it with my caretaker. I think that'll probably be free forever.
Yeah.
And
I think
we
if
need
they
to
just
add
have a
ads,
full
we'll add
picture.
ads to make sure that it's
Yeah.
free.
Because I also think if you have somebody looking at the whole instead of like what's the difference between an MD and a DO? Is a DO is like, I want to look at the whole body, not just like our endocrinologist will look at our Hashimoto's, but then not know that I also have migraines, then not know, you know what I mean? Like, And so to have a full picture is a very different,
Mhm.
helpful tool. I love that.
Yeah.
I
I think
absolutely love that.
it's really interesting. I am of the belief that, I don't think we're ever going to get super intelligence from AI, if I'm being
Mhm.
quite honest with you,
Okay.
because we are designing it and we are
Yeah.
not super intelligent. And so I think like we've already maybe even hit some semblance of what the max capacity of what our AI is able to do, and it's miraculous, right? Like today, these tools have infinite context windows and incredible speed to response times that can truly give you a personalized and fully contextualized answer.
Hmm.
And the reality is, whether some people like to admit this or not, is like that is an infinitely better experience than you are going to get from a doctor.
Yeah.
Right? Some doctors will give you a phenomenal bedside manner. The doctor that you're talking about that gave you 2 hours of I
Right.
want to get to know you.
Right.
Man, well, if everybody had that experience
We
with a
wouldn't be
doctor,
here.
I wouldn't need to
We
build
wouldn't be here.
Augi,
Yeah.
right? Because that's incredible.
Yeah.
However, like that is not the reality.
No.
Most people dealing with the healthcare system, they feel like they are a number on an underwriting piece of
Mhm.
paper, or they're a number in a queue,
Yeah.
right?
You get 2 minutes.
Yeah,
2
and
minutes.
in the ironically, in the ecosystem in which you should feel and do feel most vulnerable and human, we are dehumanized to feeling like we're kind of a burden on the system and just a byproduct of a billing necessity.
Right.
And so I think that like using an LLM that has some guardrails and is secure for information and guidance, and then eventually someday, as a doctor, is an infinitely better experience.
Absolutely.
And so today we don't give any medical advice. We can't. We can't give any kind of guidance, but can we give you information? Can we give you insights? Can we help you arm yourself with next steps for your
Mhm.
conversations with your medical team? Hell yeah.
Yeah.
And I think that that's incredibly meaningful for most people who don't get 2 hours with their doctor.
Yeah.
Yeah.
Absolutely.
Yeah.
I love that.
Yeah.
Anything else you want to share?
This is your show.
That's
huh?
it, man. That's like
Rock
that's
and roll.
great, dude. I'm so excited.
Cool.
And I feel like, do you think that it could go even bigger? Like you're doing this and then you're going to eventually do something for the doctors, and then like do you have an end game in mind?
Yeah, I have a lot of, I mean, I don't know if I have like a end game vision, but I think that if you can build the bridge between patients and providers,
Mm-hmm.
right, such that providers really benefit from having that longitudinal data and predictive analysis and really want to buy into, well, no, this will lead to a better outcome for the patients.
Mm-hmm.
That's already incredibly meaningful.
Right.
The next big problem that you have to tackle and look at is insurance, because the reality is like these systems do need to bill.
That's what I was going to ask you.
And so but the problem with insurance, right, is that these are huge players. We're talking about huge, massive corporate players. And you need a tremendous amount of money to do the underwriting for insurance because you have to cover the costs. And even if you came at it with like a really creative, like I'm going to do a value-based insurance or an outcome-based insurance where you get discounts if you're healthy.
Mm-hmm.
Like if you're working a program and you're tracking it with Augi and you're showing us you're healthy, like great, we're going to give you a significant discount so you don't pay as much for your health insurance because you're doing the steps that you need to take care of your own body.
Right.
That inherently has some problems of like, well, what if someone's dealing with a chronic illness or what? And so there are all these considerations and a ton of money that's needed, but that would be the big thing that I think needs to be rebuilt.
Yeah.
And I have
an
some ideas on
overhaul.
how we do it.
Yeah.
But it won't be something that we look at for a minute.
Yeah.
Yeah, we can't.
Yeah.
We could partner with
It's
some insurance
so
companies
big.
though. We could partner today.
Oh, that's great.
Yeah.
Because it's so big.
It's really big. But then there are other things like building a marketplace. Like, wouldn't it be great if I can talk to Augi and Augi considers all these records and says, hey, we've spoken to your doctor and honestly, based off of the diagnosis there and all of your data, here's a marketplace of discounted supplements that are top tier and vetted.
Mm-hmm.
These are the 3 things you should be taking. And
Yeah.
we'll just streamline it and send it directly to your house, right? I don't really want to be a supplements marketplace,
Yeah.
but I think that every way that we can bring convenience and ease to people that are dealing with a system that's like so hard to navigate and so
Yeah.
draining, we should do that.
Yeah, it's so funny, and I can't get into much of it, but Everly had an injury,
Yeah.
and the only reason everything is consolidated is because there's a legal team that is doing that, right? And so they knew where she needed to go and because they're
Wow.
experts in this thing.
Wow.
But I thought about it when we were at one of our appointments because there was like a neuropsychiatrist and then there was like a neurologist and that like, and had they not been communicating with each other, like you said, when you said with Augie, the speech pathologist, like she has a speech pathologist in school, but I'm like,
Yeah.
hey, what worked for so-and-so isn't going to work for her because this is the part of her brain that was affected.
Yeah.
And so there is that. Thank God it's all consolidated, but like even that person wasn't talking because she didn't see the full story.
That's right.
You know, she just thought she hit her head.
That's
And
what
I was
I
like,
that's
"Oh,
what I mean when I say these context windows for chat. It's like when you can
yeah,
have full context,
yeah,
it's much more powerful.
it's so
It's so
different.
much more powerful.
Yeah,
And we talked about it. It's like healthcare in the United States is great if you have the money to spend a fortune
mm-hmm.
on a clinical team and an administrative team that are going to do that heavy lift and work.
Yeah,
AI can do that for much less.
yeah,
And we can arm everybody with
yeah.
a lot of that administrative capability. And I think that actually goes a very long way. It's like the age-old saying of like knowledge is power.
Right.
Well, if you have knowledge on everything that's relevant in your health story, you have a lot more power
Absolutely.
and agency on what's going to happen next.
Yeah.
Right?
Yeah.
And so that's sort of the first step for Augi is like let's arm people with the power of knowledge around themselves.
And I saw something recently that was like, hey, just so you guys know, the doctor is working for you. Like, I think we forget that. Do you know what I mean? Because we walk in and we just take the pill or we listen to whatever. But it's like when you're armed like that, it gives you the power to go in and kind of be like, I don't think I need that. But like, well, what about this? Did we think about all of this? And it changes the whole prognosis.
By the way, that's incredibly important. Yeah, I think people are very intimidated by going to the doctors because, admittedly, one person has gone to medical school and has been training for this for 10 years and then practicing it for however long they have been. And the other person is entirely nascent in any kind of understanding of what's actually going on from a biological standpoint. And it's good to trust experts, but it's also, we have a saying at Augi, which is, your body knows the answers. Augi helps you listen. Which is, I think important, and it is meaningful. Like your anecdote is a perfect example of like you knew something was wrong,
right?
But your doctors didn't, and maybe had you had a tool that had the full context of everything that could have been going wrong in that instance, and that example came up, you would have had the intuition to say, "Hey guys, maybe I have placenta." Still,
that's so true because when I called, they just thought I was a mom who just had a baby, and it was a phone call, and they were like, "We're not going to see you. We're not going to see you." But had they seen the delivery chart and that I needed a blood transfusion and all that, they would have been like, "Oh, maybe we should have her come in." Yeah. Oh my God, I'm so excited for this and for you. This is great. I hope you change the whole industry.
I do too. I hope I think that we will. What I really care about is, someone's got to do it. And I think that it ironically takes somebody who was like a desperate parent who was watching their kid slip through the cracks.
Yeah.
To say, well, I'm just going to do something.
Yeah.
Because it doesn't seem like anyone's doing it. I'm not going to be the guy that's like shooting a CEO in the street, but I'm going to do something.
Yeah. Well, it's like, this is your medicine. Better. So for the podcast, it's a life-changing event, which was Augi. And then this is your medicine. Is there a funniest lesson that you've learned through all of it?
Funniest lesson that I've learned?
Let's make healthcare funny.
Well, what's a funny lesson that I've learned in all of this? I think
I know this trips people up sometimes.
No, I mean, I'm thinking through a couple different options here. There's a few.
Okay. You're like, which ones can I legally say?
I've learned two things. One is just a business flow thing, and then the other is, I think, especially when it comes to health and wellness, everyone is incredibly unique, right? And so that level of personalization is very hard to scale, which is where I think we have an edge at Augi, is because the context is what personalizes things.
Right.
And so I think that will be really meaningful, because today it's impossible for a doctor to know everything about everyone and then also personalize things for people. Like, that's just very hard.
Yeah.
So I think that's something that I've really been considering a lot, and I understand why, from a bedside manner standpoint, it's like really hard to deliver that at scale for everybody.
Right.
From a business standpoint, I am like dumbfounded by how uninspiring and uncreative most venture capitalists are. And I've been like, we've been talking about this, and we've got a lot of like awesome traction and stuff. But so you talk to some people who are in that field, and it is like, oh man, you guys are lemmings in a way that is
Yeah.
mind blowing to me. Just
That's hilarious.
uncreative, never built a damn company in your life, lemmings.
Never thought out of
Yeah.
the box.
And if
ever.
I were to tell you today that so and so was investing in the company, your entire opinion would be redefined and molded by you just want to get into a good deal. And that part of it has been very fun, because I've also realized that we didn't need to do that. We've never raised any money, and we've been building, and you know, I don't know, maybe most founders can relate to this, but like I have a real disdain at this point for VCs. I'm like, these guys are just so lame. Yeah.
I love it.
Yeah.
I love it. Where can people follow you?
Me,
Augi Health. Either
I'm
one.
just Cameron Moulene.
Got it.
And Augi Health is at Augi Health on all your socials, or augihealth.com, where you can join our waitlist.
And it's AUGI. Health.
AUGI.
Yeah.
Yeah.
Yeah. Thanks for coming.
Thank you for
That's
having
great.
me.
I'm
It's so
excited
good
to
to
see
you.
where this is going to be in like a year or two.
Me too.
I'm very excited.
Me too. I'm excited to see what your show is going to be.
Yeah. Yeah. Thanks.
What is the
again.
funny thing? Have we? That was the last question.
That's
what
the last
funny
question.
Thing? Yeah.
Yeah. That's it.
So VCs are clowns and people are unique. Is the funny thing.
Okay. Awesome.
Cool.
We'll have to have you back on when we'll see where you're at in a couple of years. I'm excited.
Yeah, I'm excited.
Okay. Awesome, guys. That's it for us today. You can follow me on NicoleComedy.com or at Nicole Birch Comedy on all socials. I'll see you guys again next week. Bye-bye.